All right, today we're diving into a medical mystery, Bell's palsy. It's this thing that's way more common than you'd think, but it can still feel like something out of a movie. It can be absolutely terrifying when it happens, but, and this is the key thing, the story usually has a really good ending.
Seriously, just picture this. You wake up one morning, you feel totally normal. You stumble to the bathroom, look in the mirror, and you try to smile. But only one side of your face moves. The other half just doesn't respond. It's a shocking, really unsettling feeling, and it's something thousands of people go through every single year.
So, what you're seeing here, that's Bell's palsy. At its core, it's a sudden, acute paralysis, or at least a major weakness of all the muscles on one side of your face. We're talking everything, from your forehead and your eye, all the way down to your mouth. Okay, so here's a term you're going to hear a lot with this: diagnosis of exclusion. What does that mean? It basically means doctors can't just run a test for Bell's palsy. Instead, they have to be detectives and rule out everything else first. The official definition is pretty dry: acute facial palsy of unknown cause. But it all boils down to one thing: a problem with the seventh cranial nerve. That's the nerve that controls your entire face.
All right, so let's get into what this actually feels like for someone. The single most jarring thing about Bell's palsy, it's how fast it hits. It's not a slow decline, it's boom. And when I say it affects the whole side of the face, I mean it. You've got the classic drooping eyebrow and mouth. You literally can't close your eye on that side. Even your forehead wrinkles vanish. And then there's other weird stuff, like drooling you can't control, food tasting strange, or sounds being painfully loud. And the craziest part? All of this can go from 0 to 100, peaking in just 2 or 3 days. It's incredibly fast. So that's the what. Now for the big question, why? Why does this happen? To figure that out, we've got to do a little detective work on the anatomy involved. The whole clue to this mystery lies in the path that facial nerve takes. See, it has to snake its way through this really long, really narrow, bony tunnel inside your skull. The best way to think about it is like an electrical cable running through a tiny, tight pipe. Now, what happens if that cable suddenly swells up? It gets pinched, right? It gets compressed, and the electrical signal can't get through to the other side. That's exactly what's happening to the nerve in Bell's palsy.
So, okay, what's causing the swelling? Well, we have a few prime suspects. The number one theory, the one most doctors lean towards, is a dormant virus suddenly waking up. We're talking about things like the herpes simplex virus, the one that causes cold sores, or the chickenpox virus. These things can just hang out, inactive, in your nerve cells for years. Then, for some reason, they reactivate and cause the nerve to get inflamed. Other suspects on the list? Maybe reduced blood flow to the nerve, or even your genetics. Some people might just be born with a slightly narrower tunnel for that nerve, making them more likely to have a problem. And this leads us to probably the most important part of the whole process. How does a doctor know for sure it's Bell's palsy and not something much, much scarier? This is where the real diagnostic detective work begins. Because let's be real, this is the first thing that pops into anyone's head. Your face is paralyzed, you're freaking out, and your mind immediately goes to the worst case scenario, a stroke. But there is one surprisingly simple clinical sign that helps doctors tell the difference, and it can bring a massive sense of relief.
Okay, pay attention because this is the key. With Bell's palsy, the entire side of the face is knocked out, top to bottom. That includes your forehead. A person with Bell's palsy cannot raise their eyebrow or wrinkle their forehead on the affected side. But with a stroke, the forehead muscles are usually okay. They're spared. Why? Because the forehead gets nerve signals from both sides of the brain. So if the doctor asks you to raise your eyebrows and you can, that's actually a sign it's not Bell's palsy, and they need to look for something else, like a stroke.
And here we are, back at that diagnosis of exclusion idea. A doctor can only officially call it Bell's palsy after they've crossed everything else off the list. They have to do a really thorough exam to make sure there isn't a tumor pressing on the nerve, or an infection like Lyme disease, or even just a bad ear infection causing the problem.
This chart kind of gives you a peek into a doctor's brain. You can see the logic. They start with the symptom facial paralysis. The first big question is, does it affect the forehead? If yes, it's peripheral, and they start looking for causes like ear issues or Lyme disease. If they check all those boxes and find nothing, they land on idiopathic facial nerve palsy. That's just the fancy medical term for we don't know the cause, which is Bell's palsy. It's a system to make sure no stone is left unturned. It's also good to know that Bell's palsy isn't just an on or off switch. It's a spectrum. Doctors actually have a grading scale. The House-Brackman scale is the common one, to rate how severe it is. It goes all the way from grade 1, which is totally normal function, down to grade 6, which is complete paralysis. Absolutely no movement on that side of the face.
Okay, so you've been through the shock of it happening and hopefully the relief of getting a diagnosis that isn't a stroke. So, what now? Well, now we get to the best part of the story, the road to recovery. And for most people, it's a really, really good road. The game plan for treatment is actually pretty clear. Step 1, and this is the most important, get to a doctor fast. The main weapon we have against this are corticosteroids, like prednisone. They're powerful anti-inflammatories that help reduce that swelling around the nerve. But here's the catch. They work best if you start them within the first 2 or 3 days. Doctors sometimes add an antiviral medicine too, but the science is still a little bit out on how much that helps. And then, the last piece of the puzzle is all about protecting your eye.
And I can't stress this enough. Taking care of that eye is non-negotiable. Think about it. You can't blink. That means your cornea, the clear front part of your eye, is just open to the air. It can get dry, dusty, scratched, and that can cause real permanent damage. So using lubricating eye drops all day long and gently taping your eyelids shut at night isn't just a suggestion, it is absolutely crucial.
Okay, now for the single most important piece of information in this whole explainer. The prognosis. The outlook. Just take a look at this number.
Yup, over 85%. The takeaway here is massive. The outlook for Bell's palsy is excellent. The vast, vast majority of people have a significant or even a complete recovery. And for a lot of them, they start seeing improvement in as little as 3 weeks. Full recovery might take a few months, but that is just such a hopeful, reassuring number.
Ooh, okay. That was a lot. So let's just boil it all down. What are the key things you absolutely need to remember about Bell's palsy?
All right, here's the cheat sheet. 1, it's a sudden paralysis of your facial nerve. And critically, it is not a stroke. Remember the forehead test. 2, we don't know the exact cause, but a virus waking up is the prime suspect. 3, it's a diagnosis of exclusion. You rule everything else out first. 4, getting on corticosteroids quickly is the key to treatment. And 5, and this is the big one, the chances of a great recovery are incredibly high. So I want to leave you with this final thought. Our faces, they're how we communicate, how we show joy, sadness, surprise. They're so wrapped up in our identity. So what happens when even temporarily you lose that ability? How does a condition like this challenge our sense of who we are? It's a fascinating question about the link between our physical body and our inner self. Definitely something to think about.